this video, I'm going to talk about HbA1c. If there's one blood test that you need to be familiar with if you have diabetes, then it is HbA1c, as this is the most important blood test that tells you how your diabetes control was over the last 3 months. This is a simple blood test that can be done any time of the day, and you don't have to be fasting for this blood test. Essentially, what the HbA1c tells you is what your blood glucose were like over the last 3 months. When you check a finger prick blood glucose level, it only tells you what your blood glucose was like over the last 2 to 3 hours, which is not a good way of looking at your diabetes control, as different times of the day your blood glucose could be at different levels. So the best way to get an overall idea of what your diabetes control was like over the last 3 months is to check a HbA1c. Ideally, you should have at least 3 HbA1cs in a year, as that tells you how your diabetes control was like over the last 3 to 4 months. Ideally, in people with diabetes, the HbA1c should be less than 53. If your HbA1c is above 53, that indicates you need improved diabetes control. Certainly, if your HbA1c was over 64, I suggest you talk to your doctor, as you might have to adjust your diabetes treatment. If women with diabetes are considering pregnancy, it is important that you have a HbA1c of less than 48, as having HbA1c of less than 48 before pregnancy significantly reduces complications associated with diabetes in pregnancy. While target HbA1c should be less than 53 to the vast majority of people with diabetes, it can be relaxed in certain people. Again, the HbA1c should be an individualized target, as some people can have low blood glucose levels if they try to achieve a HbA1c of 53. And certainly in elderly people, we have a much more relaxed HbA1c target, and that should be discussed with your own doctor, as trying to have strict diabetes control can lead to low blood glucose levels in elderly people. That could be more harmful for them than having a tighter blood glucose control. While we use HbA1c as a way to track diabetes control in people with diabetes, it's also important to remember that in certain cases we can't use the HbA1c to track diabetes control, and these are people who have blood disorders, or people who have bleeding disorders, or people who have very advanced kidney disease, and also any disorder that affects your blood count can make HbA1c difficult to interpret.